And welcome back to Ask the Doctor. I'm your host, Mike Berger. We're talking about neurostimulation with Dr. Kenneth Reed of the Reed Migraine Centers. Dr. Reed, walk with us through the process of determining who may or may not be a candidate for this procedure.
Well, the first step is once the patient becomes interested in this procedure would be, we'd like them to come to an information seminar. We actually give these around the United States in major metropolitan areas, but here in Dallas, typically every other week, every other Thursday night at one of our hospitals, we'll do a full information seminar. I'd like the patient to come in. We spend a lot of time going over this in detail, the pros and cons. We generally will have a patient there, like Kay is here today, that they can talk to the patient about it. And it's to help the patient determine for themselves whether or not this is something they're interested in. If they are, then the next step is a visit to the doctor's office, one of my colleagues for a new patient visit, go over their case in detail, determine whether they're a candidate for the trial procedure. It's 2 steps. The first step, the test. 2 weeks or so after that, they'll do the test stimulator, just as Kay described a bit ago. And if it's successful, meaning they get a very good response, they really like it like Kay did, then about 2 weeks after that, we have them come in for the full implant.
Okay.
The battery lasts a good long time, and they tend to be very happy.
Good. Here's an email question, and we want to get to some questions. Carrie in Dallas writes, what kind of follow-up care would I need with this neurostimulator?
Well, it's an excellent question. I really appreciate it. At first, the first 6 weeks, there's a few visits to our office, mainly for us to check the system, that it's functioning correctly, to fine-tune it, if you will, with programming. But once it heals up after about 6 weeks, we have the patient return as needed. We'll have some patients that'll go for years without having to come back in. So in other words, there's not a lot of problems with this, not a lot of fuss or muss. It tends to be very easy.
Very good. And we talked about the seminars, where they are. They're at different hospitals. So if someone wants to get information on that, they can either call your office or they can go to the email and ask you.
Exactly right. I think the numbers are up here on how to call, or I'd probably recommend visiting our website, reedmigraine.com. We have the seminars listed. We have a lot of patient information, testimonials, and then I have some videos of frequently asked questions. They can get a lot of information from the website.
Now, you mentioned the battery lasts a long time. Can you be a little more specific about that? And when the battery eventually dies, which they all do you just go back in and re-implant a new one and away you go?
That's exactly what we do. I can be very specific. The battery lasts upwards of 10 years. It's a very reliable time. For the 10 years, it's going great. When it does run out of energy, and we know that when it's coming up, if the patient needs it beyond then, it's a very simple 15-minute outpatient procedure just to switch the battery out, and they're good for another 10 years.
How safe is the procedure, and are there any risks?
Well, of course there are. This is a medical procedure. It's a surgical procedure, and as with any surgical procedure, there's risk. But given that, we feel it's actually a very, very safe procedure. The things people are concerned about, such as problems with the brain or spine or nerves, it's extremely safe for that. There's never been an instance of nerve damage or anything like that at all. The one risk of the procedure, the most common one, would be a very small risk of infection. Any surgical procedure,
Sure.
anything implanted could have a slight risk of infection, which is absolutely treatable. But that's really about it. People tend to do very well with this. Problems are very, very rare.
Very quickly, Dr. Reed, I know the people out there have about as many questions as I do, and we could stay here all day. What's the best way to get some information again?
I really think the best way, the first step would be the website. Tremendous amount of information there. But for somebody that's really interested, no question, the best way is to come to an information seminar. There's no pressure. It's purely us providing the information, a lot of times for questions and answers.
Very good. And once again, I'll remind you that email's website is www.reedmigraine.com, or you can call their phone number 1-855-5-MIGRAINE. So either way, if you would like more information about Dr. Reed's procedure, by all means get in touch with him or one of his associates at the Reed Migraine Centers as soon as possible. Thank you so much for joining us. Have a great day.
This program is sponsored by Reed Migraine Centers and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.